Let's dive right into this explainer. For decades, we've basically handed patients a massive burden. We expect them to navigate labyrinth-like hospitals, decode dense clinical jargon, and figure out complex insurance policies, mostly on their own. But today, we're looking at a major, really fascinating paradigm shift in modern healthcare. We're moving away from just demanding that individuals be health literate, and instead, we're exploring how healthcare systems must structurally create that literacy. We are going to unpack the evolution of the health-literate organization, with a major focus on the 6 specific, essential skills required by both patients and the institutions that serve them.
So, here's our roadmap for today. First, defining health literacy. Second, those 6 essential skills. Third, the organizational environment. Fourth, the levels of health literacy. And finally, number 5, the literate organization.
Let's kick things off with Section 1, Defining Health Literacy.
According to the foundational literature we're analyzing, health literacy is really a mix of both science and art. The science part is having that systematic capacity to actually obtain, process, and understand health information. But it's also an art, right? It takes an immense amount of cognitive, intuitive, and social capacity to safely navigate the healthcare system today. Think about a patient who just received a life-altering diagnosis, like type 2 diabetes. Grabbing a pamphlet from the doctor's office, that's the science. But processing those major lifestyle changes, figuring out the exact timing for medications, and doing all of this while under severe emotional stress, that is where the cognitive and social capacity really kicks in. It's all about making appropriate, informed health decisions when faced with layered and, honestly, sometimes conflicting information.
Moving on to Section 2, the 6 essential skills. At the micro level, the source material identifies 6 absolutely critical skills an individual needs to effectively participate in their own care. These competencies chronologically build on each other. First up is access to services and information. We aren't just talking about physical access to a clinic here. This means digital literacy for navigating patient portals and the ability to spot reliable, evidence-based info over online medical myths. Number 2 is cognitive understanding. This leans heavily on health numeracy. For instance, figuring out what take twice a day with food literally means for someone working night shifts, or accurately interpreting a blood pressure reading. Third, we have social inquiry and interaction. This is huge. It requires overcoming that old-school hierarchical doctor-patient power dynamic. A patient really needs the confidence to stop a rushed physician and say, "Hold on, I don't understand." Fourth is informed decision-making, which is synthesizing clinical advice with your own personal values and lifestyle constraints to weigh the risks and benefits. Fifth is self-adjustment for health. This is the execution phase. It's the daily discipline to change your diet or stick to a tough medication schedule over time. And finally, the highest tier, social sharing and advocacy. This is where a patient takes their successful health management and uses that lived experience to help others, maybe by guiding a family member through a similar diagnosis or organizing a local support group.
Let's jump into Section 3, the organizational environment.
Now, here's the catch. We can't expect patients to just magically develop those 6 skills in a vacuum. As Kurt Lewin's foundational psychological theory points out, true behavioral change requires a dynamic interaction between a person and the environment they operate within. It's often expressed in his famous equation: behavior is a function of the person and their environment. If we want patients to master those 6 health literacy skills, the environment, meaning the hospital, the specialized clinic, the whole healthcare system, has to be actively designed to support them. Because even a highly health-literate person is going to struggle to make an informed decision in an environment that is confusing, rushed, or completely opaque.
Think about the literal environment patients face. They are trying to navigate massive systems filled with both physical and metaphorical barriers. Sure, there's plexiglass, masks, and imposing intake desks. But there are also those invisible barriers. Complex medical jargon, intimidating institutional power dynamics, and dizzying hospital layouts all create massive cognitive overload. When someone steps into that kind of overwhelming physical and administrative space, their cortisol levels just spike, and that acute stress immediately reduces their baseline capacity to process critical health information. Literally, under stress, an individual's health literacy plummets.
Next up, Section 4, Levels of Health Literacy.
To give us a clear metric for improvement, Professor Don Nutbeam's academic framework breaks health literacy down into 3 evolving tiers. At the baseline, we have functional health literacy. This is purely about reading labels and following a clinician's basic orders, so the organization's focus here is just patient adherence. The next step up is interactive health literacy. Here, the patient can effectively communicate, extract information, and adapt when their health situation inevitably changes. But the ultimate clinical goal? That's critical health literacy. At this advanced stage, patients are actually empowered to analyze the root socioeconomic determinants of their own health. A perfect example of this is a patient who realizes their neighborhood lacks fresh food access and then joins a community organization to advocate for local policy changes to fight systemic diabetes risks.
So the crucial takeaway here is this profound paradigm shift. The old model, individual health literacy, basically pointed the finger at the patient if they failed to grasp complex medical instructions. Why is moving away from that so critical? Because when you blame the patient for misunderstanding, you inevitably see more medication errors, significantly higher hospital readmission rates, and just worse health outcomes overall. The new model, organizational health literacy, flips the script. It declares that the system holds the structural responsibility to facilitate understanding. We are no longer trying to fix a supposedly deficient patient, we are repairing a deficient system so the patient can actually thrive.
Which brings us to our final stop, Section 5, the literate organization. An organization can't just hand out some easy-to-read pamphlets and call it a day. Becoming a true health-literate organization, or HLO, requires deep structural embedding that maps directly back to those 6 individual skills we talked about earlier. Integrating literacy into the core mission and operations ensures there's actual funding for these initiatives. Intensely training staff in communication skills directly builds a patient's capacity for social inquiry. Providing easy-to-navigate physical signs and intuitive digital portals completely supports that crucial access skill. HLOs also mandate targeted strategies, like the teach-back method, where a provider asks the patient to explain the care plan back to them to guarantee cognitive understanding. And fundamentally, an HLO uses universal precautions for clear communication. By ensuring every single patient gets clear, jargon-free information, the organization removes shame from the equation entirely. It empowers patients to move toward genuine, informed decision-making. When this is successfully implemented, proactive engagement totally changes the clinical dynamic. You see healthcare professionals using highly visual, clear, and accessible educational materials. By doing that, they actively lift the burden of comprehension off the patient's shoulders alone and share it. It shifts the entire interaction away from a paternalistic lecture and into a collaborative, equitable partnership. And that naturally encourages the interactive and critical literacy skills needed for successful long-term health management. I'll leave you with this final, really vital question to evaluate your own institutional environments. Are you demanding health literacy from your patients, or are you actually designing a system that structurally creates it? Transforming into a health-literate organization is a continuous journey of quality improvement. But as the data clearly demonstrates, it is absolutely the most effective path to equitable patient outcomes. Thanks for joining me on this explainer, and remember to keep asking the right questions.